Hi, I'm Dr. Surindher. I'm the Director of Cosmesis India. I'm an aesthetic, reconstructive and plastic surgeon at the center. What exactly is penile enlargement? Penile enlargement is basically increase in the girth of the penis, that is the width of the penis. So that can be done by various methods. Some non-surgical methods like fillers have been used, which is not a very recommended procedure, but yes, it has been used. And there is some talk about PRP producing an increase in the girth, which is platelet-rich plasma, which is using your own blood, but it all has its own limitations. If you want an actual increase in girth, then there are the most common two methods which are used nowadays. One is using a flap. Flap is basically a piece of tissue which has its own blood supply. So that is raised from the abdomen and it is inserted under the skin of the penis to increase the girth. And the second or a simpler version is fat grafting, where we take fat and we inject it under the skin of the penis. But again, with fat grafting, there is a limitation as to the amount of fat that you can put in there because the fat has to survive. And secondly, once the fat survives there, it is going to change the shape of the penis shaft. So you have to be very careful in how much quantity you inject, and you don't want any calcification there, and you don't want any problems happening there, which is going to be a long-term recurring cause of concern. So these are the two methods. The less invasive one is the fat grafting, and the more invasive one is where we use your own tissues to build up the girth of the penis. Again, as I said, penile length and penile girth are very relative indications for surgery, and it is all more for a psychological benefit rather than actual physical benefit. Very rarely there are cases where you can get physical benefit as well. This is not to be confused with the penile implants, which are basically silicone rods which are put into the penis inside the muscle, but that is only for patients who have impotence or who cannot get an erection. So that's a totally different condition from the actual penile enlargement which is done for normal people. Again, with this, people ask about the side effects. Yes, any surgery, any procedure has its own side effects. Loss of libido is a major concern for most people. That is usually not the case. There may be local complications like fat which can get not absorbed, or the fat can get fully absorbed. You can have healing problems, and that is all during the first few months of the healing process. Long-term effects are usually not very significant if it's done properly by trained people. There are some nerves, significant nerves, which carry the sensation to the penis, which come around that area, but those have to be preserved. So that is why you have to go to a trained person to get this done. And the fat grafting also, as I said, if you put too much of fat, sometimes as you gain weight, the fat also gains weight, and then it changes the shape of the penis. Instead of looking like a penis, it looks like a brinjal kind of a thing, which totally defeats the purpose. So that is why it has to be done in limitation, and it has to be done by properly trained people.